Thank you, Mr. President. Colleagues, I come before you with a very short amendment that essentially cedes everything else that you've wanted, except it carves out a space for people to be able to receive mental health care. I've served in this body as the co-chair of the Mental Health Caucus for several years. This body has shown its dedication and commitment to mental health care access and treatment. And I think that it's imperative that if we want to care for people who are on our state health benefit plan holistically, we need to make sure that people have access to mental health care. Now, what you might not understand is that the term gender-affirming care, it's a broad term. And for most people, the first step towards gender-affirming care is psychotherapy. And also, if this body really is committed to trying to make sure that children don't transition, I will be clear with you that oftentimes it's in psychotherapy that children learn that they don't need to transition. They're able to work with therapists to talk about their gender dysphoria, to talk about their understanding, and they often come to a place where they don't need to transition. I would argue for the majority party that access to mental health care and being able to talk to a therapist about gender dysphoria, particularly for children, is actually your stopgate. It's your first point where you could prevent someone from a child from actually wanting to transition. So I'm ceding a whole lot here just by asking you to say, like, okay, if this is your goal, if your goal is for people to never transition, if your goal is particularly to make sure that children don't transition, then they need to talk to a therapist, and we need to cover that. This is not a political point that I'm trying to point. This is really about access to mental health care. This is about helping children get the care they need. If you have a son or a daughter who is struggling with their sexuality or their gender identity, I would hope that the first thing that you would do after having conversations in your family and really talking through with your child, I would hope that you would turn to a trained and licensed therapist to talk to your child about that issue. That should be our next step, and we should be able to do that under our state health plan. So again, this is not about politics for me. This is about care for children, about making sure that people have access to that very, very first stopgate, which is talking to a therapist where they might be able to work out some of their issues around gender dysphoria. And some of those kids will say, you know what? You're right. I don't need a transition. And maybe another kid will say, I do. But they need to have a safe, trusted adult who's trained, who's licensed, who can provide that mental health care for them. And so I think that this is a compassionate vote. I think this is the right vote. And I think that, honestly, it aligns with the majority party's aims here if they want to help make sure that children don't actually transition. With that, Mr. President, I will yield for questions.
You do have one question, Senator. Senator from the 14th.
Thank you, Mr. President. Senator Yield.
Yes, I'll yield.
Okay. Just to be 100% clear, because I actually have not thought about this before, and we have not talked about this. So the child that goes in for counseling, in theory, a child could go in for counseling about gender dysphoria not knowing what it's called before they ever identify as trans.
That's right.
Yes, right?
That's correct.
And if the counselor is reporting to insurance, like if they're a licensed provider of mental health care, and they're reporting to insurance, they usually have to code it somehow, right? Correct?
That's correct.
And what you're saying is if the counselor sees that the child has a gender dysphoria issue, they would probably have to do a treatment code that would cover that. And under this bill, even if the child is not trans, the state plan would not be able to cover it because that's how the licensed person would have to code the treatment, correct?
That's correct, and I'll break it down a little bit more. So let's say that you have a child who expresses when they, so therapists in the room, if you've been trained in mental health at all, you know there's always a person who comes into the room and they have a presenting issue. But oftentimes, a couple of sessions in, you learn that the presenting issue isn't the actual issue. So if a child comes in with a presenting issue of gender dysphoria, it gets coded as gender dysphoria, and that care would no longer, if we were to not pass this amendment, would no longer be cared for. And as a consequence, the therapist would not be able to work with that child to kind of dig through the things to see what's at the core. Perhaps at the core, the child does have full-on gender dysphoria and they need additional care. That's possible. But for many children, that's just because that's the presenting issue, it doesn't mean it's the end issue. And for many children, through therapy, particularly when they have a trained, good psychologist, that is the point where they can say, you know what, all I needed to do was talk to a therapist who trusted me, and I don't feel the need to go and ask for any additional interventions. And I think that's really important. I think this strongly aligns with the majority party's position. If you want children, that's your concern, you don't want children to transition, the place where that can be stopped and the children get the help that they need so that we don't have the negative outcomes that I'm always standing up here talking about, right? Children who are trans are more likely to die by suicide. They're more likely to self-harm. If we want to stop those things, those children need to have access to mental health. And I want to be clear with you, I'm not talking about mental health that automatically, therefore, the counselor leads them to the place that they must transition and have medical or surgical interventions. I'm talking about a therapist who simply sits down with your child that you love and you care about and talks with them through their issues and holds their hand and guides them as they sort through what it is that makes them feel like they are foreign in their body and helps them work that stuff out to the place where they can get to a point where they say, you know what, Mom and Dad, I think I'm okay. Or at least I can live in the body that I have right now while I grow up a little bit further. That's what good therapists can do with children who are just on the edge, who are just beginning to explore, whose presenting issue is gender dysphoria, but ultimately when you dig deeper, it's something else.
Thank you, Senator.
Yeah, no further questions, Senator.
I have no more.
No more.
Thank you for that, Mr. President. I yield. And I ask that you all would favorably consider this amendment. This is not a big amendment. It's very small. It simply allows children, especially, but all adults, to have access to mental health care, a point that I think that this entire body can agree to. With that, I yield the well.
Senator's yielded.